Bismillah Rahman Rahim. Assalamu alaikum. Topic for today's discussion is gut-brain axis, understanding functional GI disorders. And we will try to understand functional GI disorders with the help of case histories. The gut and brain connection. Why functional GI disorders are more than just in the head? The learning objectives of these case histories is to understand the gut-brain axis and its role in FGIDs, then to recognize key mechanisms, that is visceral hypersensitivity, dysmotility, and dysbiosis, that how these three mechanisms, visceral hypersensitivity, dysmotility, and dysbiosis, leads to development of FGIDs. Then to discuss a case-based approach to diagnose and management of FGIDs. Have you ever had a patient who keeps coming back with persistent bloating, pain, or unexplained GI distress, despite normal endoscopy, imaging, and lab tests? I'm sure your answer is yes. FGIDs, now called DGBIs, that is the disorders of gut-brain interaction. We know there is gut-brain interaction, and we had a lecture on this prior to this case studies. And the disorders of this gut-brain interaction is now the other name for the FGIDs, which was the functional GI disorders. The DGBIs are formally called FGIDs. They affect 40% of the global population and include IBS, functional dyspepsia, functional constipation, and more. These are not psychosomatic disorders. They were considered to be just a psychosomatic disorders that they lie in the head of the patient, or patient is making it. No, the research shows these are not psychosomatic disorders. They result from visceral hypersensitivity, that is the altered pain perception, the gut dysmotility, that is the abnormal contractions of the gut, the gastroenteric dyskinesias, then the dysbiosis, the microbiome imbalance. And of course, another cause for these are neuroimmune dysfunction. There's chronic low-grade inflammation, and this leads to neuroimmune dysfunction, which leads to disturbed gut-brain interaction. As a result, we get the clinical scenarios previously called, they were called as FGIDs, and now they are called disorders of gut-brain interaction. In this series, we shall have a couple of case histories, and we will discuss those case histories, their clinical features, symptoms, signs, investigations, and then we'll try to understand the underlying mechanisms for those scenarios and how to treat such scenarios. And these case histories will include the case history number one will be that of the IBS patient, the very common presentations in the GI clinical practice as well as in the practice of internal medicine. Another case history will be the functional dyspepsia patient. What are how they present, what are their symptoms, signs, the investigations, and what are the underlying causes and how we treat that patient. The third case history will be post-infectious IBS patient. Then we will have another case history, that is the functional constipation patient, patient with functional constipation. What are the symptoms? What are the signs? How the investigations can help? And what are the underlying causes and how to approach such patient? And the fifth case history of the series will be functional heartburn patient. So in this series, we will discuss these 5 cases: the IBS patient, the functional dyspepsia patient, the post-infectious IBS patients, the functional constipation patients, and the functional heartburn patient. And the key takeaways from these case histories will be that the functional GI disorders, now called disorders of the gut-brain interactions, are real, not psychosomatic. We will understand this. The gut-brain axis dysfunction leads to visceral hypersensitivity, dysmotility, and dysbiosis. Then the another key takeaway from these cases will be that diagnosis is clinical. That's the Rome 4 criteria. So avoid unnecessary tests unless red flags are present. We will understand all these from these case histories. And that there's multimodal treatment works best. This is another key takeaway from these case histories. Dietary therapy plus psychological interventions plus targeted pharmacology is the best way to treat these patients. And the future, the microbiome-based therapies, that is the postbiotics and fecal microbiota transplants, these are the future treatment ways of these patients. The gut-specific neuromodulators, that is the serotonergic agents targeting the ENS, this will be the future therapies for such patients. So let's continue the conversation. And please, in the comments, tell me what's your biggest challenge in managing IBS in functional dyspepsia patients. So comment in the sections below. So thank you very much. In the next vlog, we shall discuss the first case history of the series. So till then, take care. Khuda Hafiz.